welcome to Better Health Together, and you'll see that I have with me the CEO of the Australian Digital Health Agency, Tim Kelsey. Welcome.
Thank you.
And digital health is, well, from my perspective at least, is a top of mind topic. We've had a big year or so on My Health Record. First step, and I'd be really interested to hear from you about, well, what next? What do we need to do to keep building capability? And what do you think some of the challenges are going to be in that?
Well, maybe I could just, in a way, take us back to sort of first principles. Because sometimes I think people think that digital health is about technology, which of course it isn't. It's actually about the values we all want to see in a modern, person-centred health service, one that is giving patients and citizens more control over their health and well-being, giving doctors and other clinical caregivers access to better information resources to help them make better decisions.
The digital health environment can transcend what is the fragmentation and some of what we would describe as the structural issues in getting good, seamless healthcare.
Yeah, absolutely. So when you think about next steps, you're absolutely right. So My Health Record has moved to opt out now, and more than 90% of Australians have a My Health Record. Of course, I would stress that people can opt in or opt out at any point of their choosing. You can delete having one today if you wish to, or if you have opted out, you can opt in again if you choose to. But now we're looking to the future, and the future is all about exactly that. It's about improving the coordination of care that individuals experience. And we think about the fact that we now have an aged care, a Royal Commission into aged care, and at the moment, many aged care facilities are not yet connected to My Health Record. And we know, for example, that in aged care, research tells us that the instance of medication error is much higher than in other care contexts. And again, the evidence would suggest that a GP in a care home at residential facility having access to historic medicines information will make the risk of medication misintervention lower. So a big focus of My Health Record over the next year will be working with aged care providers to get them into the connected environment. But we're also looking at other ways in which information sharing can support people along their life journey. And so we'll be piloting a series of baby books, digital baby books. So young mums who will be given a paper-based exercise book to help them record the developmental characteristics of their children. And quite a lot of those mums lose those books. There's no memory of them in the system. People they forget the vaccination history of the child and all the rest of it. So the idea of a digital tool, just like any other app, that is helping those parents manage their children's health and well-being from the very first moment, seems to be a very important opportunity for digital services. So we'll be piloting those this year. We're also looking at providing digital pregnancy records for mums-to-be. Because again, Australia actually in this case has a standardised paper record in the maternity service, but again, making that digital and empowering mums-to-be to access that on their mobile phone, for example, will have all sorts of beneficial effects on their well-being during the course of their pregnancy. So these are ways in which we're beginning to look forward to how we can really elevate and build on the opportunity that My Health Record offers Australia.
One last question. I was talking with a GP recently about how we might reduce the prevalence of fax machines in general practice. And his response was, well, how will I talk to the specialists? Anyway, I wonder what your view is, because it really is a change management piece to move from the current practice with faxes to a digital.
Totally. So look, the Australian Digital Health Agency isn't just responsible for My Health Record. It's actually responsible for supporting implementation of the new National Digital Health Strategy in Australia. And one of the key priorities for that strategy is the removal of the fax as far as possible from the clinical conversation. And the way that can be effected is by nothing more complicated than essentially secure email. So we're working with providers across Australia and their industry vendors to develop a new approach to what's called secure messaging, just to enable secure correspondence from one clinician to another without the need for a fax machine.
Thank you very much, Tim. That's been a great discussion, and I really appreciate you taking the time.
Thank you.
Bye for now. See you next time.